Addiction is a disease that affects not just the substance abuser, but their family as well. Dr. Harry discusses questions that a family needs to address when someone suspects an addiction problem.
Here are some of the questions people should ask when confronting the problem of substance use disorder, addiction, or even the question of whether it exists. And that is there something going on with a conspiracy of silence within our family? Is there something that we see that we're afraid to talk about? Are we ashamed or embarrassed about our behavior or someone in the family? Does it involve a substance? Does it involve pills, drugs? Do we see behaviors that we can't identify any substance about, especially in young people? Where are they going? Is there money missing? Is there erratic behavior that we can't explain? All of these questions are in my book, Being Sober.
Substance abuse is often seen as being related to illegal street drugs, but prescription drug addiction has become an epidemic.
Oftentimes people feel that because a substance is legal and can be purchased, it's not so bad, or the prescription has come from a doctor and I'm under a doctor's orders. And that gives them license to use and abuse these substances. I should add that alcohol is a drug, a very potent one.
Dr. Harry tells us about his patient, Amy.
Amy has a miraculous story. After a devastating auto accident related to alcohol, she then was hospitalized and exposed to addictive pain medications. She has quite the story.
My drug of choice is alcohol. Very first time I started drinking was before I can even remember. The lifestyle I grew up in, it was acceptable, and it didn't really become, an issue with my daily life and functioning and have consequences until I went away to college. I would say that's when I started noticing it became more than just social drinking.
Amy reveals her journey towards realizing she needed to get help.
I was in a car accident and died in that car accident. They declared me dead, and I had partial hip replacement at 22 and, lost jobs, and I had lost all contact with family and friends and was doing things I never thought I would do to try and get by. And I think that was the moment when I just felt so empty, not only like outside things, but like completely empty on the inside. I was defeated.
Amy tells us how she's doing now.
I've known Dr. Harry since about 2011 when I moved out to the desert. He became a major part of my recovery. I'm feeling grateful. I'm honored to be able to be a part of this and to continue to give back in recovery and help in any way I can.
Dr. Harry emphasizes that recovery requires treatment for life.
There's really a myth about a 30-day treatment program where people literally are still detoxing as being a standard of care. That is no longer the case. We know now that the secret to success for the treatment of drug and alcohol addiction is enough treatment up front, meeting the patient where they are, hopefully not disrupting their whole life, getting at it earlier than later so they can continue to live and work with family, friends, and so forth, and then remain with the patient for long-term aftercare. Addiction is not curable, it's treatable, but like diabetes, no person with that diagnosis comes in and say, terrific, I have diabetes, when can I stop using my insulin? Or when can I eat normally? No, it's a disease that's chronic and is there for life. And so the treatment is to adopt lifelong strategies to treat it.